as well as the chairman of the Cabinet of Ministers. While many among us have specific areas of interest and responsibility, mine is the overarching role of keeping the Commonwealth of Dominica afloat and progressing in these very difficult times. Prior to the month of August, we in Dominica spoke to and about COVID-19 in very general and abstract terms. For many of us, it was a spectator event. We watched it unfold in Wuhan, China. We watched it mushroom in Italy, Spain, and the United States of America. And we even saw it contained in places like Israel, New Zealand, Australia, and Iceland. So those of us who have been watching and monitoring the evolution of this global pandemic have seen it from afar, from various and varying angles. This past month, however, we have felt and experienced the gravity and the reality of the crippling nature of this global phenomenon. Unfortunately, we recorded our first COVID-19 related death. And I take this opportunity once again to express my personal and my family and government's heartfelt condolences to the family, friends, and acquaintances of Mrs. Kathleen St. Helier. During the past month also, we have seen a number of recorded cases in Dominica soar from 218 on July 31st to 1,339 as at 6 p.m. today, Saturday, August 21st. As I said from the outset, I am not a scientist, and I do not propose to become embroiled in religious, philosophical, or ideological arguments with respect to the origin, the existence, or potential of this virus. What I do know is that several hundreds of our brothers and sisters who were this time last month roaming free and in good health are today in various facilities across this country, enduring to varying degrees the impact and effects of having contracted the coronavirus. I am not here this evening to peer into the past, how it got here, who brought it here, and exactly what is here will be the topic of discussion for some time to come. Indeed, in relation to what is here, we should have scientific confirmation of this over the course of the next few days, as samples have been sent abroad for analysis as to whether there was the presence of any of the known variants of the dreaded COVID-19 virus that would have contributed to the rapid spread of infection here in Dominica in recent weeks. I have my suspicion of the presence of at least one of the variants, and I am not proceeding on the basis that that suspicion will be confirmed. But it does not matter at this point, because Dominica is a part of the global community. And I do expect that at some point, while we will continue to pray and hope for the very best, Dominica will be impacted by the prevalence of these many variants currently active and being transmitted across the globe. I have heard the cries of many. I have listened to the advice of the scientists. I have listened to the advice of the economists. I have heard the pleas of the workers, and I have analyzed the perspective of employers. I have read reports from sister Caribbean nations, and I have watched television just like everyone else. So I am aware of what is happening in Europe, Asia, Africa, and North America. I know what is happening next door in Martinique and Guadeloupe. I know what the Barbados and Trinidad and Tobago experience has been. And I am in regular contact with officials in Antigua and Barbados and further enough as to how this pandemic has impacted communities and economies in the Northern Caribbean. So my brothers and sisters, I am fully briefed. This government would be justified this evening if it were to impose the harshest measures conceivable to curb the current spate of daily cases in Dominica. We could lock down this country, and no reasonably thinking individual would fault us for doing so. But while I have observed how the world has handled this virus, and while I have learned much from my discussions and dialogue with fellow leaders and with public health administrators across the region and the world, I also know something that they do not know. I know Dominicans. I know that Dominicans are not the combative type. I know Dominicans will listen to the arguments and may even respond verbally to those views which they do share or do not share sometimes. But Dominicans are not one to veer too far north of common sense. Yes, there are religious considerations. Yes, there are conspiracy theories. Yes, there are conflicting views and analyses. Yes, there are perspectives on what has caused COVID and what can cure COVID. We are believers, and sadly, many of us believe any and everything. I know that our thoughts are all over the place right now, but I also know that our prayers and our thoughts are with the 544 persons who have tested positive for traces of the coronavirus and who are tonight ill to varying degrees as a result of contracting this virus. I know that in spite of all the theories circulating in Dominica, there is no one who wishes tomorrow, no one, or next week, to test positive for the SARS coronavirus. And that is the crux of the discussion I wish to have with you this evening. Whatever you believe, whatever you suspect, whatever you think or do not think about COVID, I want each Dominican, within the hearing of my voice, to stop for a moment and ponder upon what you can do to avoid being an added statistic to the COVID positivity rate in Dominica. COVID can be avoided. There are persons on the front line of this disease who are exposed to it daily and they have not caught it. Why? Because they have taken the necessary precautions. They have practiced and employed measures to minimize their chances of catching the coronavirus disease. Before there were vaccines, they social distanced. They washed their hands frequently and they wore masks and other protective clothing. Ever since the evolution of the COVID vaccine, many have been inoculated. And this, I am sure, has added in minimizing the number of persons contracting and testing positive for the disease. So I'm not here this evening to argue with anyone. I am here saying to you tonight that the facts are clear. Across the region and the world, there are almost as many active cases of COVID-19 tonight as there were in August 21st, 2020. The difference is there were not as many deaths in the past week as there were the week of August 15th last year. And we must ask ourselves why. In many states across America, there are as many positive cases in the last 2 months as there were at the height of the pandemic last year. But there are significantly fewer deaths. Those of you who wish to argue must tell me, to what would you attribute the fact that fewer people are getting seriously ill and even less are succumbing to the virus? I am suggesting this evening, ladies and gentlemen, that Dominica uses simple, old common sense to fight its way out of the clutches of this disease and back to a position of normality in numbers. COVID will clearly be with us for some time to come. I have seen or heard of nothing that would suggest that COVID will not be around next year or the year after. What I have observed in countries like Israel, Iceland, New Zealand, and even in the United States of America is that the higher the degree of vaccination in a country, the lower the probability of very serious illnesses and deaths. Accordingly, your government shall be employing a program of pragmatism. We have ensured an adequate supply of different vaccines on Dominica. We are now working feverishly to acquire the infrastructure to house and administer the highly acclaimed Pfizer vaccine, a donation from the United States government. We will get all the vaccines to Dominica. I will go as far as to say, we will get all the vaccines within reach of every community in Dominica. We will find the resources to equip and staff centers with all that is needed to administer vaccinations to those who come forward for vaccinations. But in the final analysis, it is up to the people of Dominica, to decide on what each of you wish, not only for yourselves, but for your families, neighbors, friends, and work colleagues. The interesting thing about the transmission of COVID-19 virus is that the person having the virus, and by extension transmitting the virus, hardly knows that he or she is doing this. So no husband goes home intent on transmitting COVID to his wife. No mother would intentionally wish to transmit COVID to their children. No grandson or great niece would want to give granny or granddad COVID, knowing that they're elderly and most likely suffer from other pre-existing health conditions. Think about it, my dear friends. But this is what we do when we expose ourselves to the virus and when we do not take all the necessary precautions, especially vaccinating ourselves. And let it be clear, vaccinations do not prevent you from contracting the virus, but it contains and minimizes the likelihood of your sickness, your death, and very importantly, transmission to others. So, I want Dominicans tonight to understand that I'm not going to Parliament to pass any law to make it mandatory for anybody in this country to take the vaccine. I am not going to instruct the police to stop anyone and inquire whether they have taken the vaccine or not. What I am doing is asking each Dominican to apply simple common sense to what they are doing. If you refuse to be vaccinated, if you refuse to wear a mask, if you refuse to social distance and practice healthy habits, the chances are high that you will contract the virus and that you will pass it on to others. You may survive, but others, sadly, may not. And if you do not care about those around you, if you are not concerned about the danger that your refusal to equip yourselves poses to your friends and loved ones, then all I can say is that the Dominicans would not be as wise as I thought them to be. If we saw what happened this past month and not take all necessary precautions to stem this current spike in the number of cases, then we are not the people we used to be. If we do not understand that if Dominica does not move as a country to decrease its positivity level and therefore be removed from the do not visit list of some countries, then it is clear to me that we do not as a people understand how our bread is buttered. We do not have gold. We do not have oil. We are not a large exporter of goods or services. We need our ports of entry open. We need to trade and to do business with the outside world. Simple. If we do not unite to fight COVID, COVID will defeat us. That's my simple message to every Dominican this evening. The doctors have spoken. The epidemiologists have spoken. The academics have spoken. The ill in our hospitals have spoken. And even in some strange way, the millions of persons who have died from COVID around the world have spoken. If tonight some of us are hearing none of these messages, then I appeal to others to take all precautions to avoid those who have sight but would not see. My government will not make Peter pay for Paul. We will not lock the innocent in their homes because of the selfishness and recklessness of the guilty. We will not cause those who need to earn a living to go without bread or money to pay rent, simply because a few misguided among us refuse to see the light. We live in an era where working from home is becoming more of the norm than an aberration. Accordingly, we shall encourage employers, even in the public service, to assign as many persons as possible to work from home. I want to say to all of us that Dominica is open for business. Businesses which were not allowed to open over the past 3 weeks will be allowed to open with very few exceptions. We shall not curtail travel, but we shall appeal to travelers to be responsible. Do not expose yourself and do not be exposed unnecessarily to catching this virus. The government is doing what it can and what it must to manage the spread of this virus across Dominica. We are supplying vaccines. We have stocked up on supplies. We have adequate accommodation for a reasonable number of persons who may catch the virus in spite of. But I am warning every single Dominican right now. We do not have the capacity for a major wave of this virus overtaking our country. No island in the region or even the world does. The cases we have now, we are coping with. The number is uncomfortably high, but it is what it is. Whatever caused this current spike is being handled by the professionals. Soon we shall have the scientific evidence in terms of the presence of variants of COVID in Dominica. But I do not believe it's any variant that is at fault right now. I believe blame lies with the fact that we were arguably the first country in the region to have vaccines. But yet, our uptake rate is not what it should be. I believe many of us dropped our guard and let our defenses down. I believe that we got a little comfortable and complacent. That is why I do not support the imposition of draconian measures right now. I have the recommendations before me, but I will wait a little longer. I believe that Dominicans have learned from these past 3 weeks. I expect to see an uptick in the number of vaccines being taken by Dominicans. I expect to see greater use of masks. I personally will be appealing to persons to cooperate with the authorities. This is not a time for brightness, ladies and gentlemen. Anything you want to find, you can find it on Google. So telling me what you read on Google does not impress me. It does not impress me. Protecting yourself and your family is what tells me that you're a true man or a true woman. It tells me that you're smart or not so smart. Tonight in Dominica, the government is doing what it can to ready Dominica for any normal or predictable situation. For example, we have in stock just under 25,000 standard PCR tests, and also just under 25,000 rapid antigen tests. And we have additional supplies en route to Dominica. We have adequate medicines, and we have ordered more. We have ventilators and other needed equipment. In other words, ladies and gentlemen, Dominicans resident at home and abroad, we have what would normally be enough to see us through an ordinary spike in COVID cases. We have enough to ride an average wave. We have enough to steer Dominica clear of disastrous conditions. What we do not have enough of is the ability to control the thinking and the behaviors of our people. If we go out there and refuse the vaccines, if we board those buses and refuse to wear our masks, if we hold large gatherings and treat today as we did August 21st, 3 years ago, then we run the risk of creating a crisis situation in this country that none of us will be able to cope with or overcome without serious illness and loss of life. This is the reality. This is the bottom line. I will instruct the various line ministries to speak with you over the course of the next few days. Minister Blackwell will come on tomorrow, and the Minister of Education will come on Monday to address issues of specific concern. Will there be school? Will there be normal school? Will we increase the period of quarantine on entering Dominica? Will we request more COVID tests of persons coming to Dominica? Will we request more frequent testing of persons living and working in Dominica? These are all the questions that will be answered in the coming days. But tonight, I do not wish to confuse the issues. I wanted to bring one clear and unambiguous message to each and every one of you. You have your future and the future of your loved ones in your hands. Be careful and be wise. Rely on wisdom and common sense. Let us do all in our power to manage and minimize the spread of COVID in Dominica. We overcame many challenges before, and we can overcome this challenge now. I am confident that we can overcome this challenge like we have done many times before. Let us unite and contain the spread of COVID in Dominica. Let us use the vaccines that are made available to us. Keep wearing our mask. Maintain our physical distance. Open everyone and treat everyone as if they are possible sources of COVID. Let us tonight follow the advice of the professionals and put Dominica back on track to good health, progress, and prosperity for all. May God bless each and every one of you. May God bless the Commonwealth of Dominica. I thank you very much for the courtesy of listening to me. Let us do what is right. Let us do what is of a common sense understanding. Let us be wise, my dear citizens and residents. The health of the nation is in our hands. The question is, what are we going to do about it? Thank you. Good night. God bless you. And let us look forward with hope and optimism that we as a people, we are applying and we are going to apply common sense to this situation. Thank you. Good night.
You're looking to be part of the COVID-19 battle? Are you tech savvy, own a mobile device, and creative? If this sounds like you, here's your chance to win an attractive cash prize from the Ministry of Health, Wellness, and New Health Investment in our COVID-19 short video competition. Simply create a video up to 1 minute long, encouraging your peers to get tested, get vaccinated, or just to promote the health and safety protocols. All video entries should be submitted to the Ministry of Health at our email address at healthp3@gmail.com and will consequently be uploaded to the Ministry's Facebook page. And then the competition begins. The video with the most likes and shares will win. Visit the Ministry of Health's Facebook page for further details. Remember, we are all in this together.